Question for you. What is the difference between having celiac and having a gluten sensitivity? A lot of people may not have celiac, but they swear that gluten does not agree with them. Can you explain what a gluten sensitivity is?
It's a great question. So there are three things that I like to talk about. One is there is celiac disease, which we've been talking about. Two, there's wheat allergy, which an allergist or pediatrician could diagnose. But those symptoms are more like wheezing and exposed to wheat or hives or rashes. Those are different kinds of symptoms. But the third one you mentioned is called non-celiac gluten sensitivity is the medical name, or NCGS as is like to be abbreviated. That is a very difficult one to diagnose. There is no biological marker. There are practitioners of medicine who claim to have a biomarker, but there is none. They are working on it. So there's no blood test, stool test, saliva test. There's no test to diagnose it. But to me, if you make it real simple, it's easy. If a patient says every time they have gluten, they have vomiting or diarrhea or whatever, and they don't have celiac, you've worked them up and they're not allergic to it, they have non-celiac gluten sensitivity. They don't need to prove it to you. They have it. They've proved it to themselves. That's good enough until there's a biomarker that's good enough. And that's a real common problem now. But they don't need to be 100% gluten-free because they're not causing damage to their gut. They're just making themselves sick. So they may say, well, I'd rather have diarrhea, but I want that, gluten pizza, gluten containing pizza today. They're fine to do that, but you can't do anything about the consequences. But that's a very real diagnosis. It's not made up. It's very real. It's well defined, except we can't diagnose it. So you need to rely 100% on the patient's report.
And how common is that? Do you have any idea?
I don't have numbers, but I suspect it's at least as common as celiac disease, if not more.
Okay. No, and what you're saying makes complete sense. If you eat something continually and it bothers you, just the answer seems obviously just to cut it out of your diet.
Exactly. Just make sure you've been tested for celiac disease and for food allergy.
Okay. That sounds reasonable. Now, question for you. We brought this up earlier, but in your opinion, is gluten a villain? Is there a problem? Is gluten a bad thing to have if you do not have an allergy to gluten?
No, it's not. And if you allow me to cross into the veterinarian field, which a lot of parents have pets, I can tell you where that thought process actually can cause death to your dog. For example, dogs who are given grain-free diets can develop cardiac disease called cardiac myopathy. Their hearts become enlarged from what's not clearly understood yet, but some kind of nutritional deficiency, and they can actually die from being on a grain-free diet. So that's why our celiac patients are encouraged to eat grain, just not gluten. They can have quinoa, they can have rice, but some people even put their pets gluten-free, and I know at least in dogs that can cause death. So it's not a safe thing to be grain-free. Gluten-free doesn't mean grain-free.
So that's interesting. What other grains do you recommend to your celiac patients?
Well,
Quinoa.
quinoa and rice are easy ones. They're readily available.
Okay, I love hearing this because there's this perception now that gluten is unhealthy in general. And I'm always suspicious when anybody wants to cut a complete source of food out of the diet entirely, that that's a healthy way to live.
It probably emanates from the fact that 1% of the non-Hispanic white population has celiac. So there's one out of 100 people out there sick from it. There's also the patients with non-celiac gluten sensitivity, and then allergies. So you're talking 3-4% of the population. So that kind of spreads throughout the whole population that gluten makes you sick. And it's purported by some medical practitioners as toxic, as you've said already, but it's not. That's just part of their way of selling things to patients. Don't eat gluten. There are certain people who shouldn't, but most people can eat gluten.
Well, there's this idea that gluten is contributing to the increase in autoimmune illness. And from what you've read or what you've studied, is there any validity to that claim?
No, but what probably contributes from a gastroenterologist standpoint is alteration of the microbiome contributes to autoimmune diseases. So examples of alteration of microbiome is frequent use of antibiotics early in childhood is associated with Crohn's disease, another autoimmune gut disease. Also, breastfed babies have a much healthier microbiome than formula-fed babies. It's not to make parents feel guilty if they choose not to or can't breastfeed, but it's just a fact that the microbiome is healthier in breastfed babies. So trying to use as little antibiotics as possible, trying to breastfeed, those are important things to do. Avoiding gluten is not. Actually, whole grains promote a healthy microbiome too. So whole grain wheat bread is good for your microbiome.
That's so interesting. So, if you, Dr. Cynamon, who is the my gluten expert, if you saw options for pasta, whole wheat pasta, or gluten-free pasta, what would you choose?
Whole wheat pasta. There's probably less sugar in it and it's got more fiber. So I would go with the whole wheat pasta.
Any other words of wisdom that you would like people to hear that we might not have covered when it comes to having celiac or gluten-free diets?
Well, just make sure your child is properly diagnosed by a pediatric gastroenterologist. Also, make sure that your family members are all screened. Discuss the procedure in detail with your pediatric gastroenterologist because I think they could allay any fears that you have about the sedation and the procedure itself. I think that's very important from your child's standpoint to have a very clear and precise diagnosis and not be gluten-free indefinitely without a precise diagnosis. Also, also speak to your extended family if your child or a parent has celiac disease about those part of your family being screened to make sure it hasn't been missed in them because I hear that all the time from parents that some of the extended family took 20 years before they were diagnosed.